And joining me now to discuss this is junior doctor Basha Mukherjee. Basha, thank you so much for coming in. Well, first of all, your reaction to that research that has come out in terms of continuity of care. I mean, is that an important thing, having that continuity of care?
I think it's profoundly important, not just for the patient themselves, because they have to keep repeating themselves every time they see new doctors, but actually for patient outcomes as well, and also for the doctor. I'll give you an example. I had a patient a couple of weeks ago, an elderly patient who I saw 1 week, and she deteriorated very quickly in that 1 week. I was talking to her over the telephone, and I could tell from just the sound of her voice that something had changed. I was concerned enough that I had to call the ambulance for her. So that is the importance of continuity of care. Somebody who would have never spoken to this patient might not have picked something like that up. And this is actually shown in the data as well, that actually continuity of care actually reduces the number of hospital admissions, the mortality rate. So many factors are involved in this, actually.
So the Royal College of GPs have said, look, yes, that would be very nice, but we can't do it because the reality is we don't have enough GPs, and actually it's not always necessary for all conditions that you see the same GP, and they warned against setting targets. How do you react to that? Because, you know, surely the answer to this is to have more GPs in place, and the government are saying they are putting more GPs in place, but clearly it's still not enough.
I think we have to take a different approach in this whole problem. Ultimately, to bring in more GPs, to train more GPs, even employing more GPs from other parts of the world, there is going to be a lag in training them up to be up to speed with dealing with conditions in this country, dealing with the cultural nuances of this country. However, I think we have to see the fact that there's been over 1 million people come into this country in the last 2 years alone. So I think the problem lies in the supply versus demand. We have far too many, and the population is growing exponentially, and we have to target that. We have to target our immigration policies. And I know the government is trying to do the Rwanda plan and all of it, but I mean, I always say this, prevention is better than cure, and I do think that the Rwanda plan is a curative approach rather than a preventative approach.
Well, they would argue, I think, if the government's position is right, that they're hoping it will act as a deterrent and stop people from coming to the UK in first place. But in terms of seeing your GP, the Liberal Democrats have talked about a legal right to see your GP within 7 days, and if it's an urgent issue, within 24 hours. I mean, do you think a target like that would work? Or, as the Royal College of GP said, is that something that they think is not really something that will work?
I think, yes, I do see the point of view from Royal College in terms of not everything needs to be seen by a GP. I had a patient one time that came in because someone had thrown a paper ball at their face and they wanted me to look at their eyes, something as silly as that. So we had a wasted appointment. We're also seeing loads of patients who are coming in to look at, oh, doctor, I've not been seen by my secondary care, my hospital doctors yet. Can you write them an email? That's a very silly reason to come in and waste an appointment. However, I do think that there can be a middle approach where, the practice I'm currently working at, we are approaching something called a total triage system, which is actually going to be governed by doctors that actually triage to decide where the patient needs to end up. Essentially, is this something that can be dealt with a pharmacist, a doctor, or can this be just something that the admin team can deal with? However, to leave this to say that actually to enforce something which the Tory government have been trying to do, where they're saying that these certain conditions you have to go see your pharmacist first. Ultimately, there is nuance, and it's not up to the patient really to know whether their condition is severe enough where they should just see somebody like a pharmacist or a physician's associate, or actually would that be more beneficial for a GP to see? Ultimately, this is what we practice in. GPs practice with nuance, which is not something that is trained in the same way for other healthcare professionals.
And what you're talking about there really is a change in culture, and for patients to get used to that change in culture, because, of course, if you want to see your GP, if you're feeling unwell and the GP says, look, go and see a pharmacist, or it'd be more appropriate for you to see the practice nurse than to see me. Sometimes people react badly to that, don't they? Because they think they need to see their GP.
I think the fact there is that has been reviewed by a doctor first. What we've seen in past with 111 services, people just read off a checklist and decide if someone needs to go into A&E or see a doctor or something else, which is, medicine is not a checklist. It's something that comes with years of experience of knowing when something's off. There's so many times where I'll be reading off a checklist of, even our cancer pathways, some of them, it literally says, one of the criteria literally says GP concern. And that is something that is very difficult difficult to quantify. Sometimes you just know as a doctor that something's not right, and no amount of checklist learning really can teach that.
Yeah, but it's also to have the trust of their patients to do that and to allow the GP to say, you don't need to see me today. You can see your pharmacist, or you can see the practice nurse or whatever. I suppose, finally, the big issue about all of this is money, isn't it, really? Because, as we know, the NHS takes up a huge block of money from the Treasury each year. And in some of the devolved administrations, you take Northern Ireland, for example, it takes up more than half of the block grant to run the NHS. How are we going to deal with this? Is there a case for reform? You've talked about the changes in triage. Is there a case for genuine whole-scale reform? And how is that going to work?
I think, yes, change is definitely inevitable and absolutely necessary in this case, because no amount of throwing in money, more money, is going to solve this problem. As we've said, there are structural changes that can be made. The government, it's not the case that there's not enough money, it's where the government is choosing to spend their money. The government has actually spent taxpayer money on training up physicians' associates. They're offering them free degrees, which is a 2-year degree to essentially see patients. It's almost like the government is trying to replace doctors with giving other specialties a little 2-year degree. I mean, the physicians' associates, they only have to do 2 years. Pharmacists, they only have to do a 6-month course to be able to prescribe medication. I once saw a medical practitioner who gave me a medication because I requested it without even explaining to me what the medication did, how to use it. I actually had a really bad reaction from it. Thank goodness I'm medically trained myself, so I knew what to do. This person was able to prescribe, but they did none of the other groundwork that's needed with it. So just because giving people the power to prescribe, which is what the government's pretty much doing and pushing for, doesn't mean that you're going to get the same quality of care that you would get from a doctor.
Absolutely. And we haven't even had time to speak about AI, Bashir. You'll come back and speak to me someday about that AI in healthcare. But thank you so much, Bashir Mukherjee, for coming in. Now, we'll be looking at the growing instability on American campuses over Gaza and whether Trump is set for a triumphal presidential comeback as his trial continues on.